SLIT 2022 main intake for student admission starts now.
A shortage of drugs, including life-saving medicine, has affected hospitals across the country at present. Healthcare workers say this has exposed the country's healthcare system to risk, with the issue expected to worsen by next week. The Government Medical Officers Association organized protests in many areas after declaring a health emergency. Doctors marched from their residential quarters opposite the Colombo National Hospital towards the Lipton roundabout and then marched towards the Health Ministry.
In
the coming weeks and months, the people will face a worse crisis than what they are facing at present. They are hiding the truth from the people. The Government Medical Officers Association has decided to declare a health emergency in the country today.
Employees of the Professor Seneka Bibile Memorial Hospital marched towards the Bibile town and then returned back to hospital.
There is no health minister in Sri Lanka. There is no one to take up responsibility. There is a massive risk to our lives. We only have medicines that will last for about a month. The essential medicines that we have will only last for a couple of weeks.
Doctors from the Monaragala District Hospital, Matra General Hospital, Hambantota District Hospital and Karapite Teaching Hospital were among those who organized protests.
There is a shortage of medicines required for emergency treatment, medical treatment, diabetic patients and those with heart ailments. There is a shortage of surgical equipment as well. The Hambantota District Hospital will have to stop performing medical procedures by next week because of the shortage of medicines. The crisis will be worse than that of COVID-19 in the future.
Doctors from the Hambantota district and the Northwestern province organized a media briefing today to comment on the current situation in the country.
Some hospitals don't have streptokinase, which is used to treat heart attacks. There is a shortage of tenecteplase as well. We use neostigmine to reverse anesthesia. There is a shortage of that drug. We need large quantities of gauze when performing surgeries. There is a shortage of gauze as well. We are running out of urinary catheters as well. Nowadays there is even a shortage of Panadol. This will be a worse crisis than the fuel or gas shortage, since this affects the people's health.
There
are some medicines that must be provided for patients with heart ailments within 2 or 3 hours of being admitted. We can't even imagine the consequences of not providing those medicines. We don't know whether doctors will have to watch their patients die without medicines in the future.
Sri Lanka imports many essential medicines from China, India, Pakistan and Bangladesh. The Health Ministry's Medical Supplies Division said the shortage of dollars has affected the importation of medicines. The State Ministry of Production, Supply and Regulation of Pharmaceuticals said there is a shortage of about 40 medicines at present. The State Ministry's Secretary Dr. Saman Ratnayaka said 60 types of medicines that are in the country would last for only a week or a month. He said arrangements are being made to import medicines under a credit line from India. The Secretary noted that the Bank of Ceylon and People's Bank are to open letters of credit worth $7 million. Another loan of $20 million is to be obtained for this purpose.